Well, I'm Dr. Milind. So finally ending the suspense, and we have released the date for new date for NEET PG 2024. That is 11th of August. So we have a new date, and we are pursuing the same old dream of getting a PG seat. So we have around 35 days to realize, our dream. See, I understand as a PG aspirant over the last few years, you have faced a lot of uncertainties. NB is a very unpredictable board. They keep changing the dates, they keep changing the pattern, something new they'll bring on the last moment, and changing the strategies at the last moment is so difficult because I understand, when you have a new date, there are a lot of questions that come to your mind. So I'm making this video just to help you calm your nerves. I know you have already done the strategy. There's actually nothing new you need to do. You just need to stick to the same strategy you are facing. But as we have I know, when I'm making my videos, I always tell, there is a peak that we have to reach, because Neetpg is not a 100-meter race, rather it's a marathon. So already you have reached your peak, and suddenly there was a postponement of exam. Now suddenly there is a question in the mind that how do I maintain, because I'm happy, I'm satisfied with the date, because it's not too long and it's not like very early. It might have taken few students by surprise. So I think it's a good time that you get around 35 days. But I understand few students might face difficulty in maintaining that tempo, maintaining that rhythm. So I'll try to help you quickly in this video, that what can be done in the next 35 days. So as I have said, there is an official notification, and the exam will be on the 11th of August, and it will be in two shifts, and that is there. So eligibility remains the same for internship completion. So now we have 35 days, and what I personally feel that these 35 days which can be used for extra revision. So I always talk about the importance of revision in this exam, because the more you revise, you reduce the chances of doing the silly mistakes. See, after the exam, if you have already written PG exam in the past, you'll realize, a lot of silly mistakes that you do. When you come back from the exam, you feel, I have done this mistake and this could have been avoided, and that actually can be avoided by doing extra revision. So I think you can take it as a blessing in disguise, and you think these 35 days to just strengthen your core, and to minimize the silly mistakes. And also, one of the best way to avoid that is to not touch anything new. See, these 35 days will come, this will again open the gate for opportunities for many. So you'll see a lot of new material flushing in, a lot of new things coming in. But I don't think you need to do anything. The paper and the material, though although they have said that the paper will be set 2 hours before the exam, but the baseline has already been settled. So you don't have to touch anything new and hamper your preparation. Now a lot of students, they utilize score as a, to assess the baseline of their preparation. So I will just like to tell you that in next 35 days, how can you assess yourself? So if you're someone who is getting consistently above 140 GT score, see, 1 or 2 GT score 140, it does not signify your preparation. You should not have a haywire kind of GT scores. If you're consistently scoring good, I don't feel that you should do anything extra. You just stick to your notes, and one thing that you can do is you can do more and more MCQs, because you already have the base. The reason why you're crossing your 140 in your GTs, because you have a good base, you have a good command over your notes. So how to strengthen that is do more of your previous year questions, and do more of questions. So the more questions you solve, that will give you more confidence. Sometimes you read confidence, sometimes you read theory, but the way questions are asked is sometimes a little bit different and little bit tricky. So you need to train your mind. We call it a critical thinking, that when a question is asked to you, your brain start to process it. So more the questions you solve, the better brain will be trained for that. Also, you have to strengthen your fact based data. The reason a lot of students say, sir, I'm stuck between 140 and I want to get the higher, I want to get into the cream layer. And I think one of the reason that it happens is we do a lot of silly mistakes, and these silly mistakes are mainly from the fact based area. So make some charts. You have 30-35 days, so make the charts of all the facts that are there. Like, you can stick all over the wall, and you can daily add in your revisions. Just spend 15-20 minutes to revise those charts. Also strengthen your short subjects. Your short subject will also push you to the cream. And yes, what you need is one good revision. So just read your notes. I know you're tired, you might feel nauseating that I don't want to do it anymore, but just one more time, do a one good revision. Now, if you are someone who is scoring GT score between 120 to 140, again you need a good revision of your notes. See, I think you have a potential to increase your score significantly, and for that you need to again work on your short subjects. For that, you can do a lot of PYQs. See, as I say, the short subject, they do not change much with time, so you have more of a fact based data from this area. So you can actually do PYQs and get command over this subject. And yes, notes should be your focus. And if you ask me whether I should spend more time or MCQs or more time on notes, see, I have said in my previous videos also, if there is no knowledge here, you cannot solve more of MCQs. If you don't have data in your brain, if you don't remember the stuff from your notes, it's difficult to solve MCQs, because there are no repeats, there are a lot of clinical scenarios being asked. So if your theory is good, you can solve any MCQ. So I will say, if your score is here, spend maximum time on notes and less time on your MCQs. Also, I had released one chart, if you remember from the old videos, that you have to identify your weak subject. If you're not able to score 60-70% in your medicine, obs, gynae, PSM and surgery, if you're not able to score above 70-80% in your basic sciences and short subject, you need to work on them. To identify these weak subject and give more time on them, instead of reading the same thing again and again. If you know that some subjects are strong, don't spend much time on them. Spend more time on the weak subject and work on them. Now, if you're someone whose score is less than 120, see, first of all, I always say, you must have heard me saying that GT scores is not something that you should be worried of, because in exam it's completely a different game. But if you're getting consistently below 120, that tells you need to you know to work a little bit on yourself, and your main focus should be in the notes. Let go JTs. If your score is consistently below this level, giving more JTs, I don't know how it will help, because unless and until you strengthen your basic sciences, you strengthen your notes, you will not be able to improve your JT score, and eventually in exam the disappointment will follow. So don't waste on your time on MCQs, and trust me, you can still turn tables. It's not like if your score is below 120, you should be disheartened that I cannot be in the cream layer. If you do your notes well, if you do a good revision, you can definitely turn the tables, and I think this is something you should focus on. And if you want to feel like I want to do MCQs for a practice, definitely training your brain for critical thinking, that to the art of solving MCQs, do previous year questions. Don't waste your time on a lot of modules. So when you plan your next 35 days, if you ask me what should be my order of revision, I'll always say the basic sciences forms the core of your preparation, so finish them first. Because what happens in the end, you panic, I want to finish this and finish that, and lot of data, lot of backlog is left. Just to avoid that and just not to miss the important things, start with the basic sciences. Either follow them with the short subjects or couple them with the short subject, followed by your medicine, surgery, obs, gynae, PSM, followed by PDI, ENT and OPhtha. So this is according to the weightage of subject in your exam. So either you can make like 30 days schedule, so you can put this 10 high still subject like anatomy, physio, biochemistry, patho, pharma, microsurgery, PSM, obs, gynae, medicine. You can give around 3 days each, and you can do one limb, and you can combine them, like reading one subject can be monotonous. So same 30 days you can couple them with the short subject and PDA of the ENT. Keep the last 5 days for the fact based revision, which can help you. This is just the overview. I have given this again in my previous videos as well. So this is how you can make your daily schedule. You can start, if you study between 7 to, this is the time. Some of you have might taken a break in between because the new data was not there. Some of you might have lost your rhythm, but don't worry, you will gain that pace. You will again be able to study more and more hours in next few coming days. So now you don't waste time on social media, don't use mobile phones, don't be distracted. You have to use every single minute in the next 35 days. So spend your time like this. So you can start with the major subject like micro, and you can couple it with the short subject like derma. And as I have said, keep some time to revise your charts. So I have shown here between like 5:30 to 6. So even if you don't want to give like half an hour, I think 15 minutes is enough. So revise your data and fact and numbers every day. So in exam, you just your subconscious will remember it. And take a good rest. Don't compromise on your health and your food. And I'm sure you'll do the best in your exam. So set doable and small goals. Just because you have gotten 35 days, just don't make or enthusiastic plans that I will do it again and I'll do start over, start afresh, and I'll read a lot. Don't make these plans. Keep your calm and focus. There are no shortcuts. Don't fall for any gimmicks. Do what majority of the students, we always follow top 10 rank or 20 rank. You don't have to do that. We have to follow what helps to majority of the students. See, there is a role of luck, but hard work will always take out the luck factor, and I'm sure you will win. So I hope this video will help you, and I wish you all the best and take care.